Hi, my name is Linda McKinley, and I've been working in nursing for 25 years, so I've been able to get around a little bit. I've worked both private and public. The majority of my time has been spent in the military or with the VA hospital. Been able to work in Wisconsin, Texas, South Carolina, and Pennsylvania. It was when I was stationed in South Carolina and getting a master's degree in public health that I got interested in healthcare epidemiology. And I've actually worked 20 years in infection control. Actually, the statistics for healthcare associated infections are pretty frightening. There's 2 million hospital-acquired infections, resulting in 100,000 deaths per year and costing billions, tens of billions of dollars each year. To address these issues, there's been a lot of public policy placed, including public reporting of infections as well as non-payment for preventable conditions such as catheter-associated urinary tract infections and surgical site infections. Unfortunately, these requirements rely on antiquated infection control surveillance systems. There really hasn't been much that has changed over the past several decades in identifying different trends or even outbreaks. We basically manually review lab results on a daily basis looking for these trends. So obviously, informatics solutions are going to be an important part of addressing infection surveillance. I feel like I've actually waited my entire career for informatics solutions, and I do believe that we've come a long way just with the implementation of electronic medical records. But even with knowing that we have electronic patient data available, those of us who work with it also realize that getting that data back out or getting data reports is not simple. So we still have a long way to go. There is a new solution in infection control in a system called data mining software, where the software actually continuously reviews patient data, all of it, pharmacy, radiology, lab, vital signs, patient demographics, admission, discharge, transfers, all the different components of an electronic medical record, and provides continuous surveillance as well as can provide real-time alerts and also very timely analysis. Well, I am a believer in informatics solutions, and I'm going to talk about one example of where I believe this can make a difference. So it has to do with isolation. So we in infection control continuously place patient in isolation. And right now we've actually at our facility have done a pretty good job of placing patient in isolation. We get alerts when certain lab tests are ordered, and we also get alerts when certain lab test results return positive. And based on these reports or alerts, we can place patient in isolation. Unfortunately, we haven't been able to do the same thing in discontinuing isolation. So we've been able to address it from the front side but not from the back side, and I do believe that these data mining systems will be able to help us solve that. So each infectious disease has a different criteria for discontinuing isolation. It could be based on a negative test result or a resolution of symptoms. Sometimes it's a combination of those two, and sometimes the criteria is even more complex. But the way the data mining system could be worked out is that criteria can be defined, and once a patient meets that criteria, infection control could be alerted and isolation could be discontinued. So solutions are really important for this because there are consequences with isolation, both behavioral health issues from patients being in isolation, as well as the possibility of increased adverse events or even decreased time related with time with their providers or other healthcare workers, as well as increased resources in both healthcare workers' time and precautions, the use of precautions such as gowns and gloves. So hopefully I was able to explain this to you, and I look forward to working with you in class.